My name is Rebecca Asney. I am a community health educator and I've been at CARE since April 2019. Before coming to CARE, I worked with youth in a variety of settings. I worked with youth as a child advocate at Turning Points, domestic violence shelter, at Family Youth Interventions Transitional Living Program, which is a residential program for teens. And in both my undergraduate and graduate internships, I worked with students as a school social worker in all grades. My philosophy as an adult has always been to be the adult that you needed when you were a kid. And I remember really relying primarily on my peers for guidance, for information. And you know, that can be riddled with misinformation and not the same as support from adults. And it's not that the resources weren't there for me, it's that I didn't know how to find them and how to access them. So I really wanted to come into this field and be that connection and be that support for youth that I needed. So knowing that I could come in and be that information, be that guidance for them, and to come in as that resource for teachers who are already balancing a full plate, who need that assistance from external resources, and to help build that bridge between the youth and between the adults in their life and in their environments that are really the anchors of their resiliency. So giving the youth and the students the tools to know when and where and how to find the resources, and also giving the adults the skills and the knowledge to respond effectively to that outreach and to initiate that outreach on their end as well. Really, I work with schools across the whole county, from the northern end to the southern end, and mostly in my role in Paper People, our early childhood substance use prevention program. That's really the widest scope of my reach. And that's for preschoolers through first graders, but I also work in more of the southern end of the county in high schools and middle schools with our Bot Then Life Skills program as well. Paper People is our early childhood substance use prevention program, and it's so much fun. We use games, we use music, we use dancing, we use puppets, we use so much to really engage our young learners in early concepts of building healthy behaviors, because that's really the foundation of substance use prevention. It's not just the education piece, that's a big part of it, but it's also establishing those healthy relationships and healthy behaviors and those coping skills. So we touch on healthy body safety and physical safety, we touch on emotional regulation skills and developing healthy relationships and communicating effectively and taking care of our bodies. One of the main lessons that I've learned is that it's never too early in a child's life to start discussing substances. And that's some feedback I hear every once in a great while. Someone will say, well, for Paper People age, it's really not relevant for them to talk about alcohol and smoking and vaping. But it really is, because they see what's happening around them. And kids these days are taking in information from more angles than ever before. So observing behaviors, hearing about it from older siblings, older peers at school, on the school bus, in the classroom, from gaming forums, from social media. They're just inundated with information, and it can be a lot of misinformation. So it's really important for us as adults to beat them to the punch, to get in early and start laying that foundation of knowledge and start helping them develop those healthy and realistic perspectives on substance use. Realize in this process is that among adults, there's still kind of a pervasive myth that substance use prevention comes down to tough love and scare tactics. But again, going back to that really crucial piece about building healthy behaviors and healthy habits, when adults come from a place of connection and empathy and support and filling the gaps in youth lives for mental health support and encouragement and enticing extracurricular activities, then that's the way that we're going to make the most difference and see the most positive outcomes.